Hello, everyone. We're coming to you from the ADSA meetings here in Kansas City. With me is Miguel Chirivi, right? Yeah, good.
Correct.
And Andreas Contreras. Almost rolled my R. Anyway, they are from Michigan State University. Miguel is a third-year PhD student, and Andreas is a advisor and associate professor there at the university. Miguel did a presentation, I believe it was yesterday, an oral presentation, and the title of his talk was Lipolysis Inhibition Improves Clinical Outcomes in the Treatment of Ketosis in Dairy Cows. So very interesting. Had a conversation just earlier and found that very interesting. Why don't you give us an overview of the work that you did and the presentation you gave yesterday?
Okay. First of all, thank you for inviting us. It's great to be here with you. The main idea of this clinical trial was to enroll clinical cows with clinical cases of clinical symptoms of ketosis, and those cows were from a commercial dairy. So the idea with this study was to not just treat the ketosis in the terms of improving glucose concentrations, but also we want to inhibit the increased lipolysis that is occurring in those cows.
Okay, very well. And then Andreas, what was the protocol for this trial? How did you set that up?
So the idea was to use the standard treatment that commercial hosts use for treating clinical ketotic cows, and that's propylene glycol. And as Miguel said, that propylene glycol really targets the hypoglycemia in those cows.
Yeah.
But also we wanted to include lipolysis inhibitors, because as you know, lipolysis dysregulation is one of the key leading factors to the development of clinical ketosis. So we use two inhibitors. One is niacin, that targets the classic lipolytic pathway, and the other one is banamine, which targets the inflammatory pathway for obvious reasons, right? It's an NSAID. So we enrolled about 110 cows, Miguel, and we divided them in 3 treatment groups, and those treatments included the glycol, the standard treatment, glycol plus niacin. It is the rumen protected niacin from Balchem, and the third treatment was propylene glycol plus niacin plus the flunixin, meglumine or banamine. And we also enroll control cows that were matched by days in milk and lactation number. And we started the treatments, and can you please describe the treatments, Miguel?
The treatments?
Yeah, the dosing. And
Oh, okay, correct. So propylene glycol, it was the dose that had been used for the dairy farm. It was 300 grams of propylene glycol once per day for 5 days. Niacin was administered 24 grams once per day for 3 days. And the cows that received the flunixin was administered 1.1 milligrams per kilogram once per day for 3 days.
And just kind of for clarification, I think that was 24 grams of the rumen-protected niacin,
Correct.
Not just straight niacin.
Correct.
Yeah, very well. I'd like to introduce my co-host for the session, Dr. Glenn Ains. He's Technical Service Manager for Balchem. Welcome,
Thank you.
Glenn.
Appreciate it, Scott. Always good to be here, buddy.
Yep, it is.
Just a quick question. So, I've never heard or I guess knew much about banamine in terms of impacts on lipolysis.
Mm-hmm.
So, I understand how niacin works. Method-wise, how does banamine work?
Okay, so we recently demonstrated in a paper that just went out recently that inflammation is important in controlling lipolysis. So in this paper we start looking in the effect of LPS as a model of inflammation. So we consider that inflammation is an important factor regulating lipolysis. So when we move to the banamine, so there are for sure as an anti-inflammatory drug, it could target not just the endotoxin that may be present, but also cytokines or TNF-alpha that are triggering lipolysis. But essentially, the main factor that is reported in other species is the reduction of the prostaglandins by binamine is one of the main targets of reducing this lipolysis, because it's demonstrated that prostaglandins are also targeting the lipolysis within the adipose tissue.
Interesting. Okay.
So I think is that when IL-6, for example, which is a cytokine, and TNF-alpha are secreted by immune cells or by the adipocytes in the fat tissue, those two actually trigger lipolysis, and it's an independent pathway to the classic pathway, which is the one that's triggered by adrenaline or growth hormone.
Mhm.
So when the interleukins bind to a receptor in the adipocyte, that triggers actually the activation of lipases. So the idea was to target the two triggers of lipolysis in the adipocyte in cows that were clinically ketotic. So that was the goal here.
In anticipation that they would be sort of additive.
Yeah.
Yeah, which is why you did the propylene, then the niacin, and then the propylene and the niacin and the banamine.
Correct.
Okay, yeah, that makes sense.
Mhm.
And so, in terms of how you evaluated the cattle and their response to it, can you address that?
Correct. So we, as Dr. Contreras mentioned earlier, so we have some criteria for inclusion. So we established that cows that were recovered also when they were free of clinical symptoms, when they recovered the feed intake, and most important, when BHB levels were lower than 1.2 millimoles. That was the point for inclusion. So we collect specifically samples on day 3, day 7, and day 14, and in those days we evaluate the rate of recovery of those cows.
Okay. And what did it tell you?
So essentially, we start observing immediately at day 3 a better recovery in the cows that receive the niacin, and also in the cows that receive niacin plus flunixin, being better for the cows that receive the combination of niacin and flunixin. And specifically on day 7, it was statistically significant, this difference, and we observed that the combination of this niacin and flunixin had 1.4 more chances of recovery than a cow that received just the propylene glycol.
So you saw the additive effect that you were
Yes,
looking
yeah.
for.
So if you wanna look at it in practical terms, the lowest recovery rate was for glycol alone. The intermediate was for glycol plus niacin, and the faster recovery rate was for the cows that had banamine and niacin in the treatment. We evaluated also the reduction of lipolysis by measuring NIFAS and BHB.
Mhm.
And we also, when we collected adipose tissue explants, we evaluated how responsive was the adipose tissue to lipolysis and how responsive was to insulin. Because one of the reasons why lipolysis becomes dysregulated is because the adipocytes do not respond to insulin, which is an inhibitor of lipolysis. This is the major inhibitor
Yeah.
of lipolysis.
They become insensitive, basically. Yeah.
So when we evaluated that, the adipose tissue explants from cows that were treated with niacin and banamine responded better to insulin than the explants that were from cows that were only treated with glycol.
Yeah, so the biology follows the logic, right?
In this study.
I know that doesn't always work that way.
I hope in the follow-up studies it
Yeah.
does too.
So if you were to just think in terms of, I think we talked earlier that when you looked at the cattle, they had clinical signs, they were down, they were lethargic, all those fun things that you get to deal with when you've got a clinically ketotic cow, and then you treated them. And then from a physical perspective, just observationally, did they recover very quickly? Did it take a few days?
Very quickly in the cows that had both inhibitors. The herdsmen at this dairy, they were very happy with these treatments because they say, well, you got the magic bullet. The next day they are fine and they're eating a lot, and they return to production faster than the cows that were only treated with glycol. So they were pretty
Interesting.
happy at the farm.
I'll
Yeah.
bet. Yeah. one more headache eliminated, or at least reduced.
Well, at least for the clinical ketosis. Right?
Yeah, yeah. So what's next?
So we want to actually explore this more in detail to see what happens when you include NSAIDs in the lipolysis control within adipocytes. Because this really has something to do with the way maybe prostaglandins, maybe interleukin receptors actually modulate lipolysis. So what if we reduce the production of those interleukins, of those cytokines? What's the impact on adipocyte lipolysis? So that's one thing. And we also want to include, obviously, niacin in the equation because there is an additive effect that's clear. So those are the next steps with this.
Yeah. Well, you're probably somewhat familiar with Reassure, our protected choline product, which can help move fat out of the liver, right? So maybe that would help as well. I'm just tossing out some
certainly.
research ideas for you.
Obviously, this research this experiment was focused exclusively on the adipose tissue.
Yep.
We need to include the liver in the equation, obviously, and then some treatments that certainly would target the liver, the hepatocyte.
Sure.
Include.
Yeah, lots of interest in the research world over this whole inflammation thing. It's huge.
Oh, I agree. Yeah.
Gentlemen, this has been a very interesting conversation. I'd like to go on a bit longer, but we have our next interview up next. So would like to say in closing, Miguel, third year PhD student, what's the future for you?
So essentially, first to finish my PhD.
Good idea.
It's a good idea. Yeah. Then I would like to keep doing research. So for sure, I would like to do a postdoc, and then let's see what happens.
All right, very well. Well, the best of luck to you.
Thank you so
Andreas,
much.
thanks for stopping by. Appreciate you guys spending some time with us this
Oh,
afternoon.
thank you very much for the invitation.
All right.
It's been a
thank
pleasure.
you.
Enjoyed it.
Thank
Thank you.
We'd love to hear your comments or ideas for topics and guests, so please reach out via email to anh.marketing@balchem.com with any suggestions, and we'll work hard to add them to the schedule. Don't forget to leave a 5-star rating on your way out. You can request your Real Science Exchange t-shirt in just a few easy steps. Just like or subscribe to the Real Science Exchange and send us a screenshot along with your address and t-shirt size to anh.marketing@balchem.com. Balchem's Real Science Lecture Series of webinars continues with ruminant-focused topics on the first Tuesday of every month, monogastric-focused topics on the second Tuesday of each month, and quarterly topics for the companion animal segment. Visit balchem.com/realscience to see the latest schedule and to register for upcoming webinars.